There is not one shred of credible evidence that any respectable scientist would consider valid, demonstrating that anything that psychiatrists call mental illness are brain diseases or biochemical imbalances. It's all fraud.
There's no reliability of diagnosis, and there is no science. It's just pseudoscience. It's pretend science.
Prominent doctors and psychiatrists met in Puerto Rico to lay the groundwork for the expansion of psychiatric drugs far into the future. Psychiatrist Dr. Nathan Klein wrote this in the conference's final report.
The present breadth of drug use may be almost trivial when we compare it to the possible number of chemical substances that will be available for the control of selective aspects of man's life in the year 2000.
This chemical imbalance is one of the greatest fallacies ever foisted upon patients and the public. There is no chemical test to show an imbalance related to any psychiatric disease, whether it's depression, anxiety, what have you.
The chemical imbalance is for the benefit of the psychiatrist. It has to be there so that psychiatrists can treat it.
How is electric shock therapy done?
We use these electrodes. We place them on the patient's head like this, and then by means of this machine, we pass a controlled electric current through the brain, just for a fraction of a second. The patient doesn't feel it.
Psychiatrists were quick to push electroshock back into the spotlight. Renaming it electroconvulsive therapy, they now give patients anesthetics to squash their screams and paralyzing agents to avoid watching the writhing of agony.
The main misconception that people have about ECT is that it's new and improved. The new and improved refers strictly to these cosmetic improvements because, in fact, they make it easier on the witnesses. The person isn't shaking all over the table. They're paralyzed now.